Good morning, okay, 8:06. Happy Monday to you. Moving around, right? Try to stand up. I get those little dings on my watch. You know what I
tells you
mean?
to stand up
throughout
and
the day.
move.
Yeah, absolutely. And trying to get up and move, and that's pretty important. Somebody knows about movement. Dr. Cari joins us this morning. Movement Matters Physical Therapy. How are you, Dr. Cari?
I'm doing great. How are you guys?
So, is moving important to the human body, or can I just sit like a bump on the log and watch a lot of like repeat TV shows for like the next 5 years? What do you think?
It is the most important thing you can do, in my opinion, but
All right, let's talk about Movement Matters Physical Therapy. How'd you get into the PT space? I like using that phrase too, the
Yeah,
PT
That's what the insiders call it.
That's exactly right. How'd you get into
Yeah.
it?
so I always knew I wanted to be a PT from a young age. Like the 7th grade is when I finally made my decision. I was a competitive gymnast and I have a diagnosis called Ehlers-Danlos syndrome. So I have a lot of joint dislocations. So I did physical therapy all the time. So I kind of decided pretty early on, I want to do PT. I want to help people. But it wasn't until I was in college applying to PT schools that I kind of experienced the neurological side that I didn't even know really existed in physical therapy. I worked with a lady who had MS, and her physical therapist came in and trained me how to help her exercise, how to help her around the house. She was on faculty at UNC, so kind of how to work and all of those things. So that kind of opened me up to the other sides of physical therapy.
And through your journey in physical therapy, has it been all ages? Have you come across all different types of people in it? Because I would think, younger, maybe it doesn't happen as often, but I could be wrong, right? You had a condition that you've lived with as well. So do you treat all ages of people through PT?
Yeah, I primarily treat ages, I would say probably 7 or 8 and up. So I don't work with pediatrics with like developmental issues or impairments, just because I'm not trained in that. But if somebody has a sports injury or another alert condition, like maybe a traumatic brain injury or something, I've worked with younger kids. But primarily in my practice now, I see maybe teenagers through middle age is probably kind of the main age groups that I see. But I've seen people from 8 to 95, I think was my oldest client.
And
So,
you were also mentioning that you have some specialization with MS and the neurological side. Can you share a little bit about that with us?
yeah, so once I started my training at UNC, they had an MS scholarship program. And having had worked with that patient, Joanne, before, I was like, I think this is kind of meant to be. So I actually started specializing in MS through school. So I actually traveled up to Buffalo for one of my clinicals because that's where the prevalence is highest. So there's a lot more training and expertise up there. So I did that kind of right along and got my specialist certification in MS back in 2015. So I've been working pretty closely with the MS Society since then.
And so for MS, for those that don't know what exactly that entails, multiple sclerosis
Correct.
is the name of that. And so PT, how does that play into MS?
Yeah, so that's kind of where I'm a little bit different. So a lot of times people with MS, they struggle with maybe fatigue, but weakness, spasticity, things that we might see in the physical therapy world, but in different ways. So it's very easy to overwork somebody with MS from their fatigue standpoint or from muscle weakness. They also have to exercise in a very different way. So if they're trying to build leg strength for walking, they have to strengthen the neurological connection to the brain, not the muscle. There is nothing wrong with the muscle. It's just that connection. So we have to do very functional things that are going to be different than doing a leg press or something like that to strengthen your quads.
There's so many things in the health and wellness
Right.
space that you can learn. There's a lot of great people to connect with. Dr. Cari of Movement Matters Physical Therapy. You've got a health and wellness fair coming up as well for the community. Share with us about that.
Yeah, we're so excited. So a colleague of mine, Elisa Gillespie of Proactive Motion PT, and I came together back in January and decided we wanted to start a networking group specifically for women working in wellness in the Lake Norman area. So we started that and we've grown kind of slowly, but referral based. So we've been bringing in people we already really know and trust and kind of bringing in people they know and trust because we spend an hour with our clients. And so they ask us all the time for referrals for everything. And so I was like, I really want to create a group where I know the people. I'm like, this patient told me that this person's good, but really wanted to kind of build that community. So we have about 15 members now and decided we wanted to put on a health and wellness fair. So that is coming up this Sunday at our office in Huntersville.
So the opportunity is for the public to come in and meet these folks, that the relationships that you all have been building together as professionals.
Yes, absolutely. So there's going to be 10 of us in the office. I will be there, Movement Matters, Proactive Motion Physical Therapy, UFlow Yoga. She is about to have a baby, so we're hoping she can hold on until Sunday.
Hang on, baby.
Yeah. We have Crystal Clear Imaging, Sparrow Functional Fitness, New Way Chiropractic, Holistic Family Medicine of Lake Norman, Skin Click, and Neora. And then we have a couple people that couldn't actually be there in person, but really wanted to participate. So we also have Lakeside Chiropractic, Balanced, and Lake Norman Doula. So those are kind of the different people that you could meet there. A lot of us are doing free screenings, like skincare consultations. We've got a ton of raffles and giveaways and some snacks and samples. So it should be really fun.
I will say, thankfully, I've not broken anything before that I've needed physical therapy. I know multiple people that have needed physical therapy. My mom being one of when she broke her kneecap once. Yeah. Yeah, tough. She didn't want to go to physical therapy, though. I imagine that there's two ends of the spectrum. People who are like, let's get it. I need to get back, versus I do not want to be here. You're forcing me to do this. Is that the kind of difference of what you work with in a day?
That is. We a lot of times have the two extremes, the people that really need a little pushing and to learn that some discomfort is okay, and it actually teaches the brain to be okay with discomfort. But then we also have the people that we have to rein in because we're like, well, we got to bring it down a little bit. Now in my private practice, I have a tendency to see people that are more self-referred. So the people that I'm seeing are very motivated. They are wellness driven. They just want to get better. So it's been crazy coming from the big healthcare system into this. People get better so much faster because when I ask them if they're doing their exercises, they actually are. So it's really exciting and rewarding when that happens.
You would also mention to us vertigo. I think that's interesting too. I've heard from multiple people, I feel like recently, that talking about vertigo.
I've heard it too, but you don't think about physical therapy to treat vertigo.
No, and it's honestly one of my favorite things to treat because it's the one thing pretty much in physical therapy that we can treat and fix and you're done potentially in one session. Maybe two, but usually just one. So there's some crystals in your inner ear, and I know it sounds crazy when I say it, but they can become dislodged and go into a different part of the inner ear, which tells your brain every time you move that you're spinning when you're not. So people and their family members might actually see their eyes twitching, almost in not a full circle, but kind of twitching back and forth. So there's a maneuver that we do based on whichever canal it's in, which ear it is. We have lots of different maneuvers that we can do to actually fix it right away.
That's not the craziest thing we've heard in this room before.
It is. Honestly, it's not, no.
You want to be in a room of professionals so you don't feel
That's right.
crazy, especially when it relates to health and wellness. The Lake Norman Health and Wellness Fair coming up this weekend. Okay, what time is the event? Are there raffles, giveaways, goodies, anything like that to kind of draw and help people be excited for the event?
Yeah, so the event is Sunday from 2 to 5. It is in the office that we share with Proactive Motion Physical Therapy. We have tons of raffles going on, lots of 60-minute sessions with physical therapists, personal trainers, yoga classes. We also have on our social media right now, we have kind of a pre-fair giveaway going on with 5 of us. You can win kind of some smaller prizes like a mini massage gun, foam roller, things like that. So if you kind of follow us and tag us, you can enter in that if you can't make it to the fair.
Very cool. Dr. Cari, Movement Matters Physical Therapy, movementmatters-pt.com. Check out the Lake Norman Health and Wellness Fair this weekend. Thanks, Dr. Cari.
Thank you so much.